Good morning, everyone. It's bright and early on a Tuesday morning, but we appreciate you logging in for our first Butler County General Health District Learning webinar. I'm really excited to be able to be a part of creating some space for different departments and individuals and programs to talk about all of the wonderful work that they do, some of their short-term initiatives, and hopefully teach about ways that we and other departments and other spaces throughout the health department can support their work and help them meet their goals. I'm excited to introduce Amanda Roberson. She is the clinical support specialist down in our nursing department. Brittany, our director of nursing, is also here on the back end, and so I want to make sure that I acknowledge that she's here with us this morning. But we're very, very excited. Amanda's going to be speaking to you about today increasing vaccines throughout Butler County. And so I am going to go ahead and pass it off to her. Amanda, let me know if you need me, but I'm gonna mute and stop my video.
Thanks, Dominique. Good morning, everybody. Thanks for joining. I am Amanda Roberson. Like she said, I am the clinical support specialist for Butler County. I am going to go through a little bit of information that we do here at the Butler County General Health District in our vaccine clinic. So the reason we're doing this is August is actually National Immunization Awareness Month. We are going to highlight the importance of vaccines for all people of all ages. Immunizations protect individuals and their communities from vaccine preventable diseases, and it is important that routine vaccines is mandated from birth throughout their adult life. On-time vaccinations prevent illnesses that lead to additional medical visits, hospitalizations, and further strains on the healthcare system. So here at Butler County Health District, in the nursing department, we do vaccine clinics for all. That includes children from newborn to 18 years old, adults that's 19 and up until unlimited age. We do community outreaches with communities such as the all Medicaid recipients, the ones that help with Buckeye, any Medicaid that has any Medicaid Ohio, CareSource, Molina, United Healthcare, CareSource, all of those, they kind of work with us in helping getting these children and adults vaccinated. We also do community outreach. We do blood pressure checks for any community events that's around that we're able to get out to establish with. We also have a community improvement for increased vaccine uptake, where we can go out to other doctors' offices and help with them for education to help increase their child immunizations as well. We go out for school education. We also do some nursing support around for the school vaccine clinics as well. We partner with community agencies, schools, coalitions to reach the areas to help vaccinate children with the new Butler County mobile unit. So we have been in the past couple of months going out into schools, districts, and helping get some children vaccinated that otherwise would not be able to get to our clinic. The Medicaid providers have been able to come out and sit with us, Buckeye, CareSource. We have taken the mobile unit to the Lakota School District. We did 3 vaccine clinics with them in June. We have a couple more set up to go out and take the mobile unit to get kids vaccinated. We have one set up for Talawanda this month as well. So we're taking our mobile unit to Talawanda School District. Actually, next week, we're going to be setting up with them. They're going to be bringing their children to the unit. We're going to be at the middle school in Talawanda and then the high school in Talawanda for a few hours for each school location. Children can come and get their vaccines that they're behind on for school-age children. We will make sure that they get their updated vaccines while we're there. It just makes it a little bit easier for the families to get their kids to the mobile unit instead of having to bring them all the way to our clinic to help the school get their kids vaccinated that are behind, and also the parents that aren't able to get their children to the clinic. Sometimes it's a hardship for them as well to get their children all the way to our clinic here in Butler County. So we are going to them. Butler County Educational Service Center, we just did a back to school clinic with them. That was a big turnout. We did have appointments there, but we also had several walk-ins that came in to get children back to school clinic vaccinated. We did multiple children there. It turned out fantastic, but we always do this every year with the Butler County Educational Service Center. They work phenomenal with us to help make sure that kids that need vaccines are able to get their vaccines in before school starts. City of Hamilton Health Department, we also partner with them. We do their vaccines for them as well. So any child or adult that needs vaccines, they send them to us to make sure that we get their vaccines updated. Also, the City of Middletown Health Department, we also do their vaccines for them as well. They do not have the ability to do vaccines at this time, so they send them to us to make sure that we get them vaccinated. The Ohio Department of Health is the ones that sends us all the information regarding the vaccines, that any change of any vaccines that happen, they make sure to let us know. When it's time for the flu vaccine to come out, Ohio Department of Health is the one that sets the standards for that. Also the COVID vaccines, when the COVID vaccines come out, they're also the ones, Ohio Department of Health is also the ones that send us the requirements for that as to who can get it, who we give the vaccine to, what age we can do, what we order, the date in which they expire, how long we have to give them, when we have to throw those away. So we have several communities and schools and coalitions that we work with to make sure that everyone that needs to be vaccinated gets their vaccines. So like I was speaking of, the back to school vaccine clinic that we just had at Butler County Educational Service Center, this is one of the flyers that we had. These were the vaccines that we offered. It was just for back to school kids. We don't just do back to school vaccines here. We do several other vaccines. As you can see, we also have a travel clinic that is now open. This is for anyone that's going outside the country. The vaccines listed are the ones that we do have available for a travel clinic. We also have an adult clinic for anyone that's 19 and over. We have multiple vaccines that are available for them. We'll go over those later in the webinar. But the back to school vaccine is always a big hit. We do that, like I said, every year. This is something that is huge because kindergartners, 7th graders, and seniors all need vaccines to be able to return back to school. So Butler County General Health Districts holds a Get Vaccinated grant. It's the GV25 grant for this year. It supports our clinic in contacting each Butler County provider to provide training, education, information to promote vaccinations within their practice. So we can go out, contact every Butler County provider. Our main focus are the ones that do vaccine for children's. We can do monthly immunization reminder calls, help them set that up to get all of their patients in that are due for vaccines. We evaluate what disparities within immunizations within the county. We identify all providers within the county so that we target certain ones. Provider education, performance evaluations within that clinic or facility that we're going to. We also identify perinatal Hep B cases that come into Butler County, and we do school-based education and training for the schools that need it within this grant. The Get Vaccinated grant, we actually go and do training on that in Columbus. There's 4 of us that go, myself, Julie, Betsy, and Brandy. We do the training so that we are the ones that actually go and we tackle this grant head on just so that we can help promote this and get all the kids vaccinated within Butler County. This is kind of the background of part of the Get Vaccinated grant. This grant or this graph will show you that the percentage of VFC providers or facilities in Butler County. If you see the ones that are in red, those are the one that is below the county's coverage rate. These are VFC providers, which a VFC is Vaccine for Children program that ensures that all children to be vaccinated regardless of ability to pay. The chart displays the pediatric immunization coverage rates for each pediatric VFC provider in Butler County. I did remove the provider and facility's name just for their protection, but as you can see, the red are the ones that we target first before we go and target the other ones. The ones that are below 50%, we really would want to get them above 50%, but we always want to target the rest of them because we want to be at 100%. We would like for everybody in Butler County to be at 100%. This is just pediatrics. So this age group actually is like 2 to 3 years old. So this is not even showing the ones that are above 3 years old. The 10%, the one that's marked at 10%, I can tell you that facility itself has over 340 patients that are 2 to 3 years old that are not vaccinated. So that means that we can go in, talk to this group of people, give them information about the GV grant that we work with. We can help them, give information to them. We work with them for 12 months, explain to them, what we can do. We can give them information. We can come in and give them education on how to keep their kids coming back. Make sure that they're scheduling the child for each immunization that's due, what time it's due. Make sure that them children are coming back. Make sure they're doing recalls. Make sure they're doing text recalls to keep the children on a schedule to come back to make sure that every one of their kids are vaccinated and get them above that 50%. The ones that are above 50%, we do reach out to them as well because we do want to exceed that 50% up to 100% because we do want Butler County vaccinated at 100%. 50% is great, but it's still not 100%. Even if we get the 50% and 60% up to 80%, that's even better than 100%. But we do work with all of these because we do have that 100% goal. Butler County General Health District, on our improvements ourselves, this is what we have worked for. We have added the adult and the travel vaccines. So now we do have the adult clinic, as I mentioned. So that is for anyone over the age of 19. From 19 and above, we do vaccines for them. We do the travel vaccines. We have expanded our vaccine distribution. Like I said, with the mobile clinic, we're going out to schools to help get school districts' children vaccinated. That's making a huge difference. We've increased our vaccine offering. We've improved outreach to clinic structure. We've implemented the text and call reminders for appointments, which has been a huge hit. So we make sure that everybody has the call reminders and text reminders. We also have implemented the fact that we can do a couple of different languages now. We only have English and Spanish we can text into right now, but we're trying to work on getting other languages as text reminders. Scheduling follow-up appointments needed before the child leaves. We make sure that every child that comes out schedules for their next follow-up appointment. That is a big issue that happens when children come out and the parents do not schedule their follow-up. They just completely forget. So we implemented that as a big process to follow up with the kids' vaccines, is to make sure that they schedule before they leave our facility. So this is our child vaccine clinic. We do that on Mondays and Wednesdays from 9 a.m. to 11 a.m. and 1 to 3 p.m. There are appointments that are needed. We do not do walk-ins. This is for ages newborn to 18 years old. We have back-to-school clinics or vaccines that are needed. So kindergarten, you will need DTaP, MMR, varicella, polio, and they must be up to date. So if your child has missed a few of these vaccines, we will get them up to date as to what they need. We will look to see back what they're missing, make sure we get them all updated before they start kindergarten. 7th grade will need a meningococcal, which is the MCV4, and the Tdap. We will make sure that we have them up to date as well. At this time, when they come in for their 7th grade vaccine, they can also get what is called the human papillomavirus vaccine, or the HPV. This is not at all required for school, but it is highly recommended to prevent any sexually transmitted cancers. We do recommend that for anyone starting at the age of 11 years old. At 11, if you get the vaccine before your 15th birthday, it's only a 2-dose vaccine. If the child gets it after their 15th birthday, it's a 3-dose vaccine. So the earlier you get it, it's the less of a series of vaccines. And then you also have your senior vaccine, which is your second meningococcal. So you get meningococcal at 7th grade and you get one for your 12th grade. The childhood vaccines that are required are varicella, DTaP, polio, MMR, or that we offer, are varicella, DTaP, MMR, polio, HPV, Hep B, Hep A, the rotavirus, Tdap, meningococcal, Prevnar 23, and we also offer seasonal COVID and flu vaccines for children. And that's only seasonal. We do not always have them on hand. Adult vaccine clinics are Thursdays, 9 a.m. to 11 a.m. and 1 p.m. to 3 p.m. by appointments only. We do adult vaccine clinics for employment, school, immigration, just to update any missing vaccines that any adult may have. Just a little note that most childhood vaccines do not require adult boosters if you're fully vaccinated, except for the Tdap booster is recommended every 10 years through adulthood. Vaccines that we have available for adults are Hep B, Tdap, Prevnar 23, meningococcal, polio, MMR, hepatitis A, varicella, and also the seasonal COVID and flu vaccines. But again, these are Thursdays, 9 a.m. to 11 a.m. and 1 to 3. We have been doing some on Tuesdays now, just because of the openings that we have, but eventually it's going to be on Thursdays only. All right, our travel clinics are on Tuesdays from 9 a.m. to 11 a.m. and 1 to 3 p.m. by appointment only. So with a travel vaccine, anyone traveling outside the United States is recommended to or required to get vaccines entering other countries. Some other countries recommend vaccines, but others require you to have certain vaccines before you enter that country. The most common ones that are required or recommended is yellow fever, which is transmitted through mosquito bites. Typhoid is one that's also recommended or required, and it's transmitted through food and water that is contaminated. Japanese encephalitis is also transmitted through mosquito bites, and cholera is transmitted through oral or fecal route. These are the 4 that is most recommended or most required through certain countries. And we offer all of these. We also offer other vaccines that are recommended or required. We look through the CDC website to make sure what vaccines are recommended or required to wherever you're going once we do your consult with you when you come into our office. All right, so who is eligible to receive vaccines at Butler County General Health District? Any child that is under the age of 18 years old that is uninsured, which means they have no insurance whatsoever. Underinsured, which means your insurance does not cover vaccines, but now most insurances actually cover vaccines. Before they did not, but now most insurances that you have do cover vaccines. Or any child that has a Medicaid insurance plan under Ohio Medicaid. Uninsured will be asked to pay a small administration fee for each vaccine. Any adult uninsured, underinsured, or with most insurance plans. We just ask adults with insurances call to verify we take your insurance. We take most insurances through adults, not only Medicaid. Uninsured also will be asked to pay an administration fee for each vaccine. Travel clinic is available for children and adults. The travel clinic does not bill insurance for any vaccines. They are all just self-pay. We will also give you a itemized statement that you can submit to your insurance to see if the insurance will reimburse you, but we do not bill the insurance for those. Okay, so where to learn more? We have a few websites that you can go and learn a little bit more about these things. The Ohio Department of Health links for vaccines for children. Again, that is to make sure that no child goes without getting vaccinated because they can't pay. So vaccines for children, required vaccines for childcare and school. You can go there. It gives you a list of every vaccine that is needed for children to attend school or a daycare, because daycares do require for children to have vaccines. Recommended vaccines for college students. Some college students do have to have vaccines that are different from school vaccines. So you can also click on that website. It will give you information as to what college students need for different colleges. Some colleges do require different ones. Other colleges will just take your school record. We also have a brochure stand downstairs in our clinic that you can come down and get all the information. There's several pamphlets down there. It's got shot schedules for children from birth to 18 years old. You can pick that up. We just have several options for you to come. You can come and ask questions. You can call and ask questions. This is our contact information. If you have to make an appointment or need to make an appointment or just have any questions. Our address is 301 South 3rd Street, Hamilton, Ohio, 45011. The main line to the health department is 513-863-1770. The nursing department, you can call myself, Amanda Roberson. You can also email me at amanda.roberson@bcohio.gov. You can call the clinic phone, which comes straight to my desk at 513-887-5253, or feel free to text me at 513-857-2115, or you can email the Butler County Health District directly on their homepage. The website is also listed there. If you have any one that needs the vaccine, or you have any questions, or you just want to come and visit, feel free. This webinar is going to be sent out to everyone. It has been recorded through this whole thing. So it's going to be shared to everyone in an email. So you all will get to see this at the end. I just want to thank you guys for joining us today and enjoy the rest of your day.